Hello, and thank you for joining the BCDA SHIP Medicare Minute. Today, we're going to be talking about Medicare and durable medical equipment. This is for the month of July 2025. Just a little introduction. My name is Allison McMichael-Dahl, and I am the Baltimore County Department of Aging SHIP Manager. We are located at the Bicota Senior Center in room 321. If you have any Medicare questions, please give us a call at 410-887-2075 or send us an email at medicareinformation@baltimorecountymd.gov. Today, we are going to be talking about durable medical equipment, what it is, what kind of durable medical equipment Medicare covers, what it doesn't cover, how does Medicare cover DMEs, credible DME suppliers, and DME fraud. So hang on tight, it's going to be fun. We're diving in. What's durable medical equipment? Well, durable medical equipment is equipment that helps you complete your daily activities, such as wheelchairs, oxygen tanks, walkers, hospital beds, power scooter, blood glucose monitors, and several other items. Medicare usually covers DMEs for 4 things. If it's durable, meaning that it can withstand repeated use, it serves a medical purpose, it's appropriate and needed for use in the home, and likely lasts up to 3 years or more. What Medicare will not cover is equipment that's used for outside of the home, items intended only to make things more convenient or comfortable, items that you throw away after one use, items that you don't use with equipment, modifications to your home, equipment not for use in the home, such as air conditioners and cotton pads, surgical face masks, and oscillating beds. Something to note that some Medicare Advantage plans may cover minor home modifications or other items as a supplemental benefit. So it's really important that you look into your care if you have a Medicare Advantage plan, because they might qualify some DMEs and cover them for like a home improvement. How to have your DME covered by Medicare? Well, the first thing you need to do is contact your primary care physician, your PCP. They must sign an order prescription or certificate stating that it is something that you need. So you need to request the DME to help the medical condition or injury. Then the equipment is in your home. And then after that, if acceptable, a face-to-face visit must occur within 6 months prior to the prescription being written. This is just so it shows that you've done due diligence, that you've talked to your physician and let them know that you're experiencing some sort of pain, and then you've worked on it for 6 months, and then they write you the prescription. Once you have your PCP's order or prescription, you must take it to the right supplier. And there's a lot of them out there, so don't get tripped up. What supplier should you use to get your DME? Well, if you have a Medicare Advantage plan, you got to follow the plan's rules, pretty much. So first, get approval from the plan before you get your DME. Pre-authorization may be required. Use a supplier in the plan's network of suppliers, and then use a preferred brand of DME. What supplier should you use if you're with Original Medicare? Well, get your DME from Medicare-approved supplier that takes assignment. You can call 1-800-MEDICARE or visit www.medicare.gov/medical equipment-suppliers for a list of these in your area. Be aware that some suppliers are Medicare approved but do not take assignment, meaning that they have the right and can increase the cost of the equipment by 15%. Medicare will only cover the 80% that it was approved of. Beneficiary will cover the 20% and any additional cost. So be aware of Medicare fraud, like DME fraud, which is one of the most common ways that individuals experience fraud. Scammers are calling and offering medical equipment or supplies to people often who don't need it or want it. They may even pretend to be a healthcare provider to get your Medicare number. They will charge your Medicare without showing medical need and sometimes without sending the equipment. And then you are stuck with the bill. All right, so be aware of these red flags. You see charges for DME on your Medicare statement you do not need or requested. You were offered free equipment or supplies over the phone. You received a cheaper, lower quality item, but Medicare was billed for a custom or fitted one. You see that DME providers continue to bill Medicare for equipment even though you've already returned it. If you see any of these red flags, it's time to call the SHIP office. So let's just imagine you receive a phone call from a telemarketer. They are from a company that is giving away knee braces. They ask you some questions, you answer them, and then they say, "Congratulations! Based on your answer, you qualify for a knee brace. In order to send it, I just need some personal information and your Medicare number." What do? Well, stop. It's likely this is a fraudulent call. You should not provide the caller with any personal information. If you receive a call like this or give out your personal information, contact your senior Medicare patrol for help reporting. Instead, we urge you to contact your primary care and let them know that you're experiencing pain and you need some DME. So let's wrap this up by giving you some additional resources, some things that here in Baltimore County that might aid you in getting your DME met. So the Maryland Access Point is a fantastic Baltimore County Department of Aging resource. They have a number of programs and connections that can link you to resources to help you get durable medical equipment. Their number is 410-887-2594. Some of their programs, this is just a few. The OT Home Safety Program, the Loan Closet, the Because Program, the Senior Home Repair Grant through the Department of Housing and Common Development. There is also the Accessible Homes for Seniors, a loan program for people 55 and up with 0% interest and deferred for 30 years. Now, if you have any Medicare questions or you've experienced fraud, please give us a call at the Senior Health Insurance Program, the SHIP office. Our number is 410-887-2059, or you can email us at medicareinformation@baltimorecountymd.gov. Some other helpful resources include 1-800-MEDICARE, www.shiphelp.org, and www.medicare.gov. Thank you so much for joining us for this month's Medicare Minute. Bye-bye.